Good afternoon. Welcome, everybody, to the latest in our series of transportation webinars. Today, we present inclusive new mobility solutions for people with disabilities. To help us understand more about new mobility options and how they address mobility for people with disabilities, we are happy to be joined by Dr. Judy Shanley. Dr. Shanley is the Vice President for Education and Youth Transition at the National Office of Easterseals in Chicago, Illinois, and she also serves as the co-director of the National Center for Mobility Management. She manages federal projects and supports the FTA. She provides technical assistance to human services and transit professionals, and she conducts research regarding inclusive mobility innovation. After her short presentation, we'll have plenty of time for questions. Please feel free to enter your questions in the question box on the side of your screen at any time, and we will get to as many questions as possible after the presentation. I'm sure you will find this discussion interesting and timely, and thank you all for taking the time to join us today. And with that, I'm going to hand it over to Dr. Shanley.
Hi there, and thank you, Alice, and thank you all of you for participating. I'm thrilled to be sharing content about inclusive mobility solutions for the Eno Center and look forward to our subsequent discussion. Turning to the agenda on the next page, I'm going to be sharing with you a little about the National Center for Mobility Management, which I call NCMM. I'll be sharing some compelling data. I'm a researcher by background, so having data to confirm or provide a rationale for what we're talking about is always important. I'll be talking about innovation, integration, and inclusion. We think of these mobility solutions as characterized by all three of those components, and I'll explain in a little bit. I'll be sharing some examples with you. As a national center, we have the opportunity to interact with states and regions and local communities, and we've gathered some examples of innovative strategies that many places have used. And then finally, I'll be sharing some federal resources. Next page. Hopefully, many of you have used the services of the National Center for Mobility Management. We are funded by the Federal Transit Administration. We're nearly completing our 5th year of being a National Technical Assistance Center. NCMM is a partnership between Easterseals, the Community Transportation Association, and the American Public Transportation Association. And our mission really is to help the field build mobility management capacity and help coordinate services so that individuals with disabilities, older adults, and those with low income, they access all the places that they want to access. I hope you've had an opportunity to utilize our services. On the next slide, I share information about travel behaviors and travel patterns. This data comes from the National Household Travel Survey from 2017, and it amazed me, some of these statistics, including one related to the fact that 25.5 million Americans have disabilities that make traveling outside the home difficult, but strikingly, 3.6 million of individuals with disabilities don't leave their homes because of their disabilities. On the next slide, we provide some trip frequency information, and it was amazing that regardless of age, people with disabilities make fewer trips per day. Think about all the work that we've been doing nationally around access to health care, access to jobs, and economic loss because individuals with disabilities are not able to access community and jobs, that it's striking that this number of people make fewer trips. And then finally, 7 out of 10 respondents with disabilities reduce their day-to-day travel because of their disability. On the next slide, I'd like to think about this work in terms of limitless imagination. What we once knew as transportation and traditional modality choices, we're way beyond that. So it's moving beyond what's traditional. I don't know if you all saw the latest, the TRB, the 2018 Critical Issues in Transportation publication, a pre-publication went out, but some of the topics there, I think 20 years ago, we wouldn't have thought of when we're talking about transportation. So I like to think of this as innovation moving beyond what we typically think about transportation. The notion of integration is also important. The notion of seamless mobility and not thinking about individuals with disabilities and the mobility needs that they have as an add-on, but thinking about the needs and services that are accessible to individuals with disabilities from the get-go, from the beginning, as services are planned, as services are redesigned. The thinking is that there's an integrated approach. And finally, inclusion. Individuals with disabilities are active, always, and meaningful participants. There's a resource that I'll share with you at the conclusion of the webinar from the Administration for Community Living out of HHS, and CTAA is the prime contractor on that. And it really looks at how individuals with disabilities can be meaningfully engaged, can be decision makers in the kinds of services that are offered. I was talking with a transit agency earlier in the week, and they were talking about a shared ride service that they had developed, and I asked them about their discussions about the implications of this new mobility service for individuals with disabilities, and they indicated that they really hadn't thought about that as they were establishing the relationship with a shared ride provider. And I encourage all of you, look for opportunities in your community to always engage organizations as intermediaries and individuals with disabilities. On the next slide, this represents a continuum of service. It's kind of the mobility as a service thinking, that mobility isn't just one mode. It's not just fixed route, the traditional buses and rails and trolleys, but thinking about things like shared vehicle programs such as Zipcar, shared ride programs, feeder systems, scooters and bike programs, volunteer driver programs hold a lot of promise for individuals with disabilities to be able to access community service. The demand response services that you build, ensuring that they're equitable and are compliant with ADA requirements, but they're accessible to people with disabilities, and traditional paratransit. I include dog sled on here. At one time I was working with Alaska, and believe it or not, dog sled is an important mobility option for many individuals and riders in Alaska. Thinking about the paths of travel. So you can't just think about the mode of transportation, you have to think about how people are going to get there. What does the bus stop look like? Is there a complete street kind of thinking about your mobility services that you're offering? And then the shared ride and ride hailing obviously is a growing kind of service. And I'm going to be sharing with you on the next slide some examples from Chicago. I'm really proud of the work that we've done in Chicago. The mayor's office for people with disabilities has been really engaged with our regional transit authority and the Chicago Transit Authority, and working with organizations, human service organizations like the Center for Independent Living, to really develop a menu of services for people with disabilities. We did a webinar, the National Center for Mobility Management did, with the mayor's office, the city of Chicago, as well as the Shared Use Mobility Center. We also did one on automated vehicles and with the Office of Disability Employment Policy. So I encourage you to go to our website for more intense and extensive information about those subjects. But in the next slide, one of the services that Chicago is really proud of is its open taxi program, where they have wheelchair accessible vehicles available as taxi service to individuals with disabilities, and they make that service available either by phone or app to enable people who may not use a phone or have visual disabilities to be able to access the service. And you can go to opentaxis.com to learn more about the service, but it's very pervasive. It's a sustained program, so we're really proud of it. On the next slide, I share information about the Chicago's work to develop rideshare relationships. We actually had an ordinance in 2016 about the numbers of wheelchair vehicles that the rideshare program needed to support. People with disabilities, the mayor's office for people with disabilities, the independent living center here were part of planning the whole service, and they continue to inform the service. So information about how the apps needed to be accessible was really built into the development of the service. And what is really great about the Chicago program is there's driver training involved. The mayor's office works closely, as do other human service organizations, with the shared ride providers to ensure that the drivers are responsive to the needs of individuals with disabilities. And importantly, there's accountability. So the rideshare providers are required to submit monthly reports to the mayor's office and the RTA about things like the number of requests, the number of rides provided, the number of vehicles, and then the kinds of marketing and outreach that they're doing. And many of these are output kind of measures, and I've had conversations with the mayor's office over time, and we're hopefully going to be collecting information about outcomes. So what does it mean for an individual with disabilities to actually have a rideshare ride? Are they able to get to doctor's appointments to any differing degree? Are they able to maintain employment because transportation is no longer a barrier? So we're looking to collect performance measures in terms of outcomes and impacts, which is really exciting. And I think we see that nationally, and many transit agencies are really thinking about how do you collect those kind of data. On the next slide, Chicago's really also proud of our adaptive bike program, and we've got a variety of adaptive bikes available to individuals with disabilities that, again, have been kind of tested and supported by various disability groups in the city to make sure that they are accommodating the needs of users that have different functional abilities. And so you see hand cycles if an individual can't use their feet, and trikes, upright adult trikes for people that have balance issues, and then tandem bikes for individuals who maybe have visual disabilities or are blind. On the next slide, one of the programs we've worked closely with over the years is Ride KC Freedom. They have an on-demand service that offers non-ADA same-day service. And what's really neat about Kansas City is they've continually refined their program based upon the needs of users, based upon ridership. So they're always collecting input regarding how it's going. And I think the administrators of the program will be the first to tell you that it's always a work in progress. And they use wait time as a measure of success. If individuals with disabilities have to wait longer than the fixed route transit for a ride, then that's not considered a good service. And so they're always comparing how the service is doing to wait times that people have to experience. On the next slide, you probably always all have seen the new innovations that Uber Wave has brought. I did a presentation a couple weeks ago with the Global Accessibility Director of Uber, and it was the audience was transition professionals and educators in the field who are using shared ride service as a way to support the transition of youth with disabilities into jobs and community experiences. And they were pointing out the various Uber features, such as the follow the rider opportunity that is available on the app, so that if a parent is putting a child, or if there's an individual with a significant cognitive disability that's using the service, an organization, a caregiver, someone can monitor the ride of that rider. We've also seen Uber integrated in transit apps. The Dallas area rapid transit is one example, and I think the mobility on demand projects, if those are the projects funded by the Federal Transit Administration, there are some really great examples about how the shared ride programs are implemented and integrated in existing service continuums of agencies as well as in the apps. And then Uber Wave just rolled out, I think it was last week, in some major cities around the country, and they too are using the wait time of 15 minutes or less as a measure that this service is comparable to those services that may be available to other individuals. And I provided the URL on this slide so that you can learn more information about Uber Wave. On the next slide, when I think of new mobility solutions, when I think of the new services that transit agencies or communities or regions are implementing, I think these are the things that should be considered as you're exploring the service. Is there empirical data associated with the service use? Has it been used for multiple audiences, not just for individuals who are blind, not just for wheelchair users, but is it used is there history of success with multiple audiences? And then also thinking about the different data. There's not just the outputs, it's not just the number of rides or the number of riders. Thinking about the qualitative comments. Are audiences, are riders liking the service? Does it facilitate their ability to access jobs or healthcare? So thinking about multiple data types. And then thinking about the multiple trip purposes. Has a service been implement just for one kind of destination, like a job, an employment site, or has the service been used for other places? Secondly, is the service defendable? Is there overall evidence of effectiveness? Is it inclusive? Has it really involved the participation of individuals with disabilities in decision making all along the way? And does it continue to be accessible for individuals with disabilities? The topic of equity is really, really critical, and I'm going to provide a resource to the FTA ADA site that has some really great examples of what does equity mean in terms of the ADA. Is the service expansive? Is it so narrow that you can't grow it? You can't extend it to other communities or other populations? And then is it flexible? Can it ebb and flow depending upon the needs of your riders? Is it measurable? You want to put a service in place that you always could collect data and continuously improve and modify. And then finally, is it sustainable? Is this a one-time kind of service? Is it resource limited in that you're never going to be able to make it last over time? So these are just some of the considerations I think that when you're implementing any service, but in particular those services that are inclusive and individuals with disabilities, that are important. On the next slide, because we're a national center that focuses on expanding mobility management and helping communities grow mobility management, I always like to think of mobility management as an amazing platform that you can build innovation from. Mobility management, because it's the practice of coordinating all of the people and organizations in the community that provide transportation, you're encouraging innovation and flexibility. You're encouraging the diverse perspectives. You're representing the diverse needs of a community through having this coordinated approach. Also having a mobility management network or forum, it's an easy way to share information, to learn from each other, to share practices, and really provides a platform for engaging customer feedback, especially individuals with disabilities. So if you don't already, please consider how mobility management can be a great foundation for you to build on your innovation. On the next slide, I provide the URL for the FTA resources, and Ina will make these slides available to you so you'll be able to access the resource. But I have found this really a valuable resource in my work in helping communities think about how inclusive services, how to facilitate the inclusivity of services. On the next slide, I share some national resources. The Federal Transit Administration provides these amazing national technical assistance resources, and I hope you all tap into them. The information and the technical assistance available through many of these is free, so take advantage of it. The National Center for Mobility Management is obviously our website. There's a National Aging and Disability Transportation Center, provides lots of really great training materials on the 5310 program and accessibility and training topics for drivers and travel training. The RTAP program, many of you are probably familiar with, has some really great worksheets and interactive tools that even if you're not a rural provider, you can access and implement in your own settings. And then the ACL Inclusive Transportation Partnerships Project is the resource that I mentioned that can be valuable in terms of how do you engage meaningfully individuals with disabilities in their organizations. And then a center that's been a close partner with us is the Shared Youth Mobility Center. They've been terrific in helping us think about what do agreements with shared ride providers have to include to ensure that they're equitable and inclusive of people with disabilities. On the last slide is my contact information. I've had a short period of time to share a lot, and I hope that this provokes some nice discussion, and I'm always available to you as a follow-up if you have any questions that we don't get to on the phone. So again, thank you for your time. I'm so appreciative of having the opportunity to interact with all of you, and thank you to Eno. I'll turn it back over to Alice.
Great. Thank you so much, Judy. We have a bunch of questions coming in, so we'll get to as many as we can. There are a number of people who are asking for some more specifics about the Chicago ordinance and what led up to that ordinance being passed, and if there's any information out there now about the data that Chicago has been collecting since they have changed their service requirements, that we can get some lessons learned, or if not, when that will be.
Great question. The ordinance came about because the city deliberately and meaningfully reached out to diverse audiences. There was some contentiousness at one point, but the contentiousness led to policy and regulatory change in the city. So it was the relationships that were established between the mayor's office and the RTA and the CTA and the human service organizations that really led to the ordinance, and the recognition that individuals with disabilities, those with low income, other populations really need a variety of choice. They need to have an array of services available, and there's not a one size fits all. So in terms of the data, I can check and see whether that's publicly available at this point. I know that there's meetings that we have community engagement meetings where they often share those kind of data, but I don't know if there's a website or a public vehicle for that site. I can check, and what I can do is share that information with Eno, and perhaps with the materials that they send out about this webinar, they can include that.
Great. That sounds great. And then some questions coming about the Ride KC project also. Do you know if there's like a fare structure or some sort of incentive to try to get people to do pickups or drop-offs at transit hubs? And then also, do you know how the program works for people without disabilities who are also allowed to use that program but at a higher fare? And if they're incentivized to do pickups and drop-offs at hubs, or if it's point-to-point.
I know that the KC Freedom folks have worked closely with the community to create programs that appeal to diverse audiences, and so they, in their communications and marketing, they include some kind of incentives to use the service. I don't know specifically if the incentives pertain to picking up and dropping off at transit hubs. That would be a good question to ask the KC Freedom folks, and there's contact information on the URL that I provided.
Great. A couple more questions about resources and finding accessibility resources. Do you know of any good resources for rural communities where isolation can be a a really big issue, especially due to long distances and traveling. And then also somebody's asking about clearinghouse for ADA transition plans, and where some examples of those could be found.
Sure. In terms of rural issue, the rural topic comes up across all of our national FTA-funded centers. The Rural Technical Assistance Project is specifically a project which focuses on that funding that comes out of FTA for rural areas, so they would be a good resource for you. But on our website, on the NCMM's website, we also focus on rural issues, particularly rural mobility management. You know, the rural areas have been quite entrepreneurial and quite creative, and we have some examples of some of those strategies. I know there was also a recent a Transportation Cooperative Research Program report that KFH had done on rural mobility management. We have that available on our website, as does the National Aging and Disability Transportation Center. So I think if you go to any of our national TA Center websites and click on, you'll see topically organized content, and you could go to rural and you'll be able to find resources. And I'm also, I could share additional examples because we've done a lot of on-the-ground work in rural areas, and it's amazing how innovative places can be because there's not a fixed route infrastructure, because the distances, as you say, are vast. Regarding the ADA transition plans, the ADA program nationally, you know, that's funded through ACL and HHS has huge amount of resources available. The regional ADA centers might be a good place to start. For the regional center that is from your state, they would have the most customized information to your particular geographic area. There's also a national ADA program that has more generic information. The FTA ADA site has some really great content about you know, what's included in your transit related, transportation related programming. So I'd say start with your regional ADA centers, and then if that isn't sufficient, there's the National ADA Center, and then the FTA related ADA information is an important source.
Great. There's a couple of questions also about partnerships, for example, with TNC companies. So there have been a couple partnerships with health organizations, such as like with Blue Cross Blue Shield, where they're connecting people to medical centers, and that will often end up serving a large number of people who have either temporary or permanent disabilities that they are living with. Do you know how those arrangements usually work and the accessibility issues behind that?
So all of these partnerships, and there are many, as you say, Geisinger and with the western part of Pennsylvania with Rabbit Transit is a big one. Blue Cross is a big one. I know United Healthcare had done a lot of partnership work. I think they're all unique. I think it's really based upon the needs of the community. I think it's based upon the parameters of what's negotiated in those relationships. In the Geisinger healthcare example that's in Pennsylvania, I know that there's several mobility options available to people, but accessibility and kind of ADA equity issues were built into the initial discussions with the healthcare organization, between the transit and the healthcare organization. So I think that if you go to, you know, the FTA funded the Rides to Wellness grants, and they're looking forward to funding some innovative coordinated access mobility grants, which bring together healthcare and partnerships. And our center, the National Center, has funded some design challenge grants. I think in all of those models, it's different. The arrangements are different in terms of who pays and hours and the kinds of services. But the one thing that they all have in common is the topic of accessibility and equity were at the beginning of the conversation.
Got it. Yeah, those are definitely interesting to look at all of the different solutions, and great to see that people are trying to come up with them. Well, that is all the time we have. We didn't get to all of the questions. We will put these slides up online for people to be able to watch in the future, and that will also include the contact information for Dr. Shanley if you have further questions about finding resources or policies or examples. And I just want to thank everybody again for joining us, and thank you very much, Dr. Shanley, for sharing all of your knowledge on the topic with us. ENO is going to stay engaged with this issue as policies and transportation options across the country continue to evolve. Besides finding a link to this webinar, you can also find more information on our website at enotrans.org, where you can also subscribe to our weekly newsletter, ENO Transportation Weekly, which is an invaluable resource on all aspects of transportation policy and practice. Thank you all for joining us, and have a great afternoon.
Thank you. Bye, everybody.